I'm Vicki Hogarth and welcome to Southwest Magazine. My guest today is Charlotte County mental health advocate Darrell Tidd. Thank you, Darrell, so much for agreeing to sit down with me today. I appreciate it so much.
Well, thank you for having me.
I'd love to start for people who are not familiar with your journey and your family's journey through the mental health system here in New Brunswick. What your story is, please share it with us.
Well, my journey began quite some time ago, probably back in the late 90s with my son Devan, who is now 32. The journey really began, I guess, at the elementary and high school level with trying to get my son extra help. We were having issues at the time, me and my wife at the time, controlling Devan with some of his issues, especially in the school system when he got a little bit older and got into the high school system. Those issues came to the forefront. We had several diagnoses. He was diagnosed with high-functioning autistic with Asperger's. He has progressive development disorder. Basically, it's just a atypical autistic. Also, adjustment disorders. Depression, of course, that comes with that, and intermittent explosive disorder. And what that is basically a violence and outburst and anger outburst. So that's where it started.
Okay, and he's spent time in everywhere from group homes to now he's at the Shepherdie Healing Center. Tell us a little bit about what all those experiences have been like for him, navigating.
Yeah, so when I mentioned high school, it came to a forefront. He was unable to finish high school. I think he actually did when he was in one of the facilities, finish his grade 12. So, but it came to a head, and there was an incident of anger and violence due to his mental health disorder, and that was it wasn't outside the home, it was within the home, and he was just uncontrollable at the time. So we had to come to a conclusion that he needed help that we couldn't give. And as a parent, that's hard. And it's hard here today to even talk about it, to be honest.
Yeah, take your time. I understand that it can't be easy, and it takes a lot to share your story and have to relive a lot of these moments.
It does, but I think it's very important because, like I said, at that time, he was within the system. Family and Community Services became involved, of course. But when I say struggle within the system at the beginning, that was one of the first challenges, was to even get him help. It took a local judge at the time to actually threaten a subpoena to the minister at the time to come up with a case management plan. The department was unwilling to do it at the time, or didn't have the mechanisms necessary to do it. So the judge challenged and actually put a subpoena that they had 30 days. And they came up with a plan at that time. So there was a plan. He spent, I think, a little over a year in a group home in St. Stephen. I knew from the get-go I had concerns and reservations about that at the time because I didn't feel all the pieces were in place to help my son. And sure enough, I was right, even though it was a cost of almost $11,000 a month billed to the taxpayers at that time. I didn't feel that case management plan would work. It didn't. It failed. From there, he went to Centre Care in St. John. While at Centre Care, he was there from October to January, I believe, until they found placement, or trying to find placement. In January, I believe it was January the 10th, that date rings a bell in my mind, that I got a call at 3 o'clock in the morning. My son had been missing from Centre Care in minus 20, 25 degree weather. No one from Centre Care called. I actually got a call from an outtake worker in St. Stephen that was notified my son was missing, in a Johnny shirt and the slippers that he had on his feet. The St. John Police Force found him about a mile and a half up the road to a convenience store that was open 24 hours, and thank God for that. So that was one of my first real challenges within the system. I mean, it almost cost my son his life. The statement from them at the time was basically he was involuntary, so he could come and go as he pleased. Mm-hmm. That wasn't the case. So from there, he, I believe, went to a group home. He did evaluation at Restigouche for 30 days, and then he came back to St. John, to Duke Street, I believe. It was probably more than 30 days because it would have took him a lot longer than that. Wow. So he was in that group home and I believe 2 others in St. John prior to him going to Restigouche, which was his major stay.
And that's, I'm going to look down at my notes for this, because you were one of the lead plaintiffs in the Restigouche class action, which resulted in a $17 million settlement. It's one of the largest of its kind in the province. Why was that? And walk people through what happened and why that was important for you.
Well, I really can't talk too much about Restigouche. As you could probably appreciate, there is a settlement, and all I will say, there was an Ombud report done in 2019 on that facility. I believe there was staff involved that came forward, addressed their concerns. I took up that lawsuit, myself and another father, as litigation guardians, or we were the lead plaintiffs, but as litigation guardians of our sons. There was a settlement in the regards to the alleged allegations, and I believe that settlement is the best course of action for the hundreds of class members that came forward and that were part of that suit.
Wow. And now your son, he's at the Shepherdie Healing Center. I'd love for you to give people an idea of what that center is exactly and how that experience is for him.
Well, when I talk about Restigouche, I can talk in general terms in regards to my son's stay there, because he was there from 2013. For the most part, I think he went to the John Howard in St. John for a little stay. That was a level 4 care home. And I'll just take a little time to explain the levels of care home across the province, because for patients with exceptional needs, there really is no level of care home that will satisfy their needs. And that's not a slight against PSWs, LPNs. I know people that work in that field. I have the greatest amount of respect for those people. I couldn't do that job. However, my son went to the John Howard, which is one-on-one. All the level of care homes really mean from level 1 to 4 is staff to patient ratio. It doesn't really mean any more specific training for the staff members there. It just means more of a one-on-one. You know, they may know some of the case history, but they certainly don't know it all. So he spent from 2013 to May of 2021, I believe it was, in Restigouche. He was transferred from Restigouche to Shepherdie in May of that year. I didn't know much about it until probably the afternoon before, or the day of. I think it was the afternoon before. I got a call, said there was a review board hearing. There was an incident that happened at Restigouche. And what I mean by incidents, it was an outbreak. He damaged some properties within Restigouche. So, I'm going to try to say this as easy as I can. With the pending litigation that was going on, there was, in my view, there was probably issues that kind of led up to that, but I'll say no more than that, other than he was transferred to Shepherdie in handcuffs and shackles, given an inmate number, and went to Shepherdie. Shepherdie Healing Center is a federal institution that the province of New Brunswick pays money per patient per bed to utilize. It is part of Dorchester Penitentiary Prison. My son has an inmate number. When you have the head psychologist a month and a half afterwards on a Teams meeting call tell me that that was no place for my son. Yeah, so here it is, 2025, my son's still there. I've been advocating to get him out of there. I know there's plans in place to try to get him a supervised apartment with 24-hour care. But, you know, that was told 2 or 3 years ago, and here we still are today.
I know that you filed a right to information request to find out what the cost is per month of Shepherdie for your son, and I can imagine that's in part to illuminate for people at home. Sometimes, if you can't get people to care about or feel compassion, what you can do is to, appeal to them as a taxpayer that these things can be very expensive. So I wonder though why you filed this right to information request, what you're hoping to find out.
Well, most certainly, it always, unfortunately, it comes down to dollars, and those are taxpayers' dollars to make that. And the reason why I quoted earlier on the almost $11,000, this was back in 2010 when my son first went into a group home. It was $10,378, I believe, in some change. I've got that number in my head. That's close to 15 years ago. I'm being told for each patient that is at Shepherdie today, like my son, that the province pays for beds to the federal government, it's almost $30,000 a month. Now that's unofficial. That was told to me by someone that probably knows some of that information, but I want to get specific numbers, because when we're talking about mental health and how we can do things differently, it always comes down to dollars and cents. There's money within the system, but in my opinion, it's being mismanaged, and it's been mismanaged for a period of over almost 25 years that I've been involved in the system. And when governments, it doesn't matter, red, blue, whatever, whenever governments say that they're going to make changes, they say they're going to involve people. Well, you know what? Involve the people that know the system the best. You'll go to other government departments, you'll go to people that you say that's within the mental health system, groups that are within the mental health system. By groups, by the way, nothing against the groups that are within the system, but most of those are funded by government. So do you think you're going to get a really honest-to-God answer out of people that are getting funded by the government to talk out too much about a in-power government at the time? No, they're not. Come back and ask family members like they did in 2009 when the current minister's father, Mike McKee, he was a provincial court judge at one time, did a report on mental health in the province. It was all party agreed to it. Yes, it was back in 2009, but there was over 80 recommendations that came out of that report. Over 2,000 people were interviewed, including family members, patients, mental health advocates, and all the rest. And for the Premier today to say, well, that was a different time, a different political environment back then, I don't buy it. Those issues that were relevant back then are relevant today. Here we are, still doing reports, putting them in provincial archives and cherry picking. It's a Band-Aid solution, and if I sound quite passionate about it, I am, because there's no other way to say it. I've been fighting the system, and fight's a strong word, and that's what it's been. It's been a fight. Not only for me, I'm doing this not only for my son, but others are out there that have no voice. And there's lots of them out there that have no voice, because believe me, going through this lawsuit and things of that nature, when it was well exposed, I've got hundreds and hundreds and hundreds of Facebook messages from people that I didn't even know. And that's actually how I found the other father that was involved in the lawsuit, is basically he's seen my report and reached out.
I know that you are part of the reason you're here today is to advocate for the mental health advocate position in the province that was the province decided to fill in 2019. This was put forward. That's when it was decided that this was something they wanted in New Brunswick. It's 2025. We still don't have that position filled. Why do you think this role is so important? Why are you pushing for this to be fulfilled?
Well, I think it's important so those out there that have no voice have an avenue. Like right now, it's all over the place. Like you have the Ombudsman's office, you have the Child and Youth Advocate's office. It's all over the place. And really, to be quite honest, there's no authority to any of those groups. They report back to government. There's really no authority. You need an advocate that has authority. You need to create a separate department and staff it with people. And this was all, I might add, this was all costed out by the current government. The whole government that's in power now has costed this out to be filled this year with a min and a staff level. And I can appreciate the response back from the Premier. I have an actual response back from the Premier saying they're still evaluating the role, the description, where it will sit, whether it's legislatively or they want to engage with community health groups, and I'm all for that. To finalize it before they go to the recruitment phase. They want to get it right and have input for people who do this today. Well, Madam Premier, with all due respect, the people that you need to talk to are people like myself, not just me, the hundreds of people that are out there that know the system best, that have been going through the struggles for years. It's time to stop doing reports and put things into action. I understand you have priorities in government, but this should be the number one priority of your government, as it was stated when you sat in going into the fall session of the legislature. Out of 4 top things, this was, I believe, number 2 on the list that I read when the media reports. And here we still are.
We did reach out to the Department of Health as well, just to see if they had any answers in terms of delay. We were given a similar response in that they are still looking into what this position could be. They did send us, though, I will read it out loud because the numbers are important. If anyone is struggling with mental health or addictions, to call the health line, which is 1-866-355-5550. So it's worth mentioning that. I'm wondering too how you see this position, a mental health advocate, different from, for instance, the youth and seniors advocate Kelly Lamrock. Would you see this as a different role entirely, or overlapping? And does it need to be something separate from his role in your mind?
Yeah, I believe it needs to be something separate because it is an important and crucial role. I think I would use the analogy going back to the current minister, Rob McKee. He's the Minister of Justice and Mental Health. His father, Mike, that I had alluded to earlier, used an analogy when he did his report. We're either going to build a house, or we're going to paint the living room. And that's a good analogy. Like, we need to get serious about mental health in this province. And one way to start to get serious about that is to have someone that's a champion for those people that are out there struggling. It's just, it just bewilders me because within departments, like, I've struggled over the years from one department not talking to another department. And when my son was placed in one of these group homes, they didn't have the full file because the other group home didn't want them to disclose because they just wanted to pawn them off on someone else. So we need someone that's a champion for mental health in this province, and it needs to be standalone. They need to have the authority to do it, within reason. I understand but we need to have someone that can speak up for those that can't speak for themselves.
You've talked about the idea of having regional facilities for patients with exceptional needs. What, in your mind, would that look like? What would be ideal?
Well, I believe it's vitally important. I've been advocating for it. I know Mr. Smith has been advocating, and there's been others that have been advocating it. Right now, we have, besides the group homes, which can't do it, we have Restigouche, and we have the Shepherdie Healing Center. So don't get me wrong, there's a need for both of those facilities, and for Shepherdie. Shepherdie's a federally run institution. But for ones like my son and one like Mr. Smith's son and all the others out there that have exceptional needs that can't be cared for in a residential group home setting, there's nothing else. So why can't we have residential care facilities for patients with exceptional needs in the major centers across this province? And if the province comes out to me about money and financing, listen, there is hundreds of thousands of millions of dollars within the system already that I have stated earlier that is not being spent where it should be spent. It's being mismanaged. That culture is within the system. And until you have a government that is willing to break that culture, we're going to be doing the same thing in the next 25 years. So I would call upon government, if they're really serious about this, it takes political will. And I know with any of the parties, when they come in, they look at things, they have their own agenda to do things. But I would implore to the Premier, I know she's taking a look at this, but I would implore to her to follow through with some of this and involve people that know the system. Instead of listening to people that will give you the answers you want to hear, come to people like myself, Mr. Smith, others. Patty Bothwick's another one. She'll tell you. Come to people like that and ask them the questions.
Mm-hmm. Darrell, you've shared your story in the past. You are going to sit down with our friends at CBC as well very soon again, and you continue to tell your son's story and your own story, because your journey with this is just as important. Your life has been just as much impacted. Why is it so important for you to take time to continue to advocate?
Listen, I'll continue to advocate to my dying breath. We need to do better. We need to do better as a society to get rid of the stigma when it comes to mental health. Our loved ones are among us, And there's plenty of people out there that don't even come forward. Their charter rights are being violated. When I say charter, I mean Section 15 of the charter that says everyone is equal under the law, regardless of their disability or their mental capacity. We need to do better, and I will continue to advocate not only for my son, but for all the others out there, like I said, that have no voice. And I would want them to know if they're struggling, there is hope. There is someone out there that you can talk to. There's people in the community, like myself. I'm no mental health care specialist, but at least an ear. If I can lend anybody out there in the direction to go, I'm willing to do that for sure. But we need to do better, and that's why I continue to fight, because I don't think today, and I don't think for the last 25 years, or longer than that we've did all that we can do as a society.
One of the most beautiful things about sharing stories on mental health is that it often opens the door to connect with other people who maybe they're not as brave to share what they've been through, but when they hear you, they can reach out, connect. I'm wondering what you've heard from other families and how you've connected by what you're doing, by putting your story out there, and then also what stories you hear from them about their own frustrations.
Yeah, I mean, during the whole journey, I've heard from, I wouldn't even want to care to guess how many, but it's been probably hundreds of people along the way, and I'd say that over the course of 25 years, but just within the last probably 5-6 years, or a little longer than that, there's people with similar stories of mine. When I first was getting a lot of media attention and things of this nature, I thought I was the only one probably around with the similar type experiences, and then I met 2 or 3 more, and some of the stories that people have shared with me about loved ones that are no longer here and the struggles they went through, it just breaks your heart. Like, you would hope as a society we could do more to help individuals that are struggling. And it's the stories are similar, that they have no avenue to go. And even when they do go to a facility, there's really no programming. And I'll just relate to that. When I said my son was transferred from Restigouche to Shepherdie, on that first phone call that I had with the head psychiatrist that basically said that there was no place for my son, he also told me at that time, when I say about warehousing individuals and our loved ones, and I don't have any proof other than a team meeting call, but I know he said it, and I don't think he would deny that he said it. And I'm not going to mention the individual's name because I believe he's in a high position. My son was on 48 different medications per day when he went from Restigouche to Shepherdie, and I'll repeat that number again, 48. And he went down from 48 in a period of a few months down to 6. So when you have someone at a facility and you're feeding them 48 meds a day, and I have all the records. I have 5 banker boxes full of tens of thousands of pages of my son's medical records because I requested it and I've got it. So I could easily prove because all those records are there. But it just blew my mind when I heard that number initially, and then I had to go digging, and then it's closer if not more.
Wow. Darrell, for people watching at home, whether they relate to this story from their own mental health journeys or someone in their family, or they're just deeply enthralled by your story and what you're going through, what do you hope they take away from watching this today? What do you hope they bring with them to their lives, and whether it's advocacy or just being able to relate and know there are other people out there that do relate?
Yeah, I would hope that they know that there are others out there like themselves or their loved ones, and there is community outreach. I don't want to suggest for a minute that there isn't, because there is. And just to keep voicing your concerns. The power of one equals the power of many, and I think we all need to remember that. If we all speak out and all can come together and have a voice and be there for each other, then I think that's how you move change. And I think we need to keep doing that, and the voices need to get louder. I know there's still a stigma attached. I think it's about the time we rip that Band-Aid off.
Yeah, and you know that the door here is always open for you, for anyone else who wants to share their stories. That's one thing we love to be able to offer to the community here at CHCO, because it is important. Stigma in itself is one of the issues, but I am wondering for people who are in decision-making roles who might be watching as well, what do you hope they take away from hearing your story today? I know maybe they've heard it before, but these long format interviews offer something different, a really human side to everything as well.
I would just hope that they hear everyone out there saying that we need to change the way we do mental health in this province. I know the Premier. I've talked to the Premier. I think she's really sincere in her wishes. I know there's struggles to make those changes, even at the Premier's level. There's a bureaucracy behind that, and I get that. You know, I worked in government for 16 years rather, not in that capacity, of course, but I realize the struggles between departments and how to get things done. But I would hope that they follow through on this mental health care advocate and get that filled. But they need, you know, I go back to the Premier saying they're listening to all stakeholders. You need to listen to people that have gone through the system. Again, just listen to the families, listen to the patients. You can listen to all the stakeholders that you want that are involved in the system, but you need to get on the grassroots ground level and start listening to people that have gone through the system and asked, what can we do to make it better? And then maybe have an advocate to push for those changes.
Well, Darrell, I can't thank you enough for coming in today, for sharing your story, and being so open with everyone at home across New Brunswick. Thank you so much.
No, thank you for having me.
My guest today has been mental health advocate Darrell Tidd from Charlotte County. I'm Vicki Hogarth. Thank you for watching Southwest Magazine.
Southwest Magazine is a news and public affairs production of CHCO Television.